Thank you very much for the opportunity to share some of our ongoing research on the COVID-19 health pandemic. This research we are doing out of Ateneo Policy Center. The presentation I will share with you today focuses on some of the effective leadership ingredients that we need in order to build trust and social cohesion during our crisis response to COVID-19. Let me begin by basically mentioning that there is now growing recognition of the importance of leadership in various sectors of society and the economy as far as the COVID-19 response goes. In business, there's now talk of adaptive leadership, of leadership that tries to manage the uncertainty, manage the risks, as well as build greater resilience in organizations. But also in the public sector, I believe it's also very critical that there's also growing recognition of the importance of leadership in different levels of government, including in international public organizations, such as the WHO, and also at the national level and at the local government level. My presentation today will draw on a simple framework that has been advanced by researchers from the University of Chicago Harris School of Public Policy that tries to understand how leadership can actually build stronger social cohesion and trust during a crisis period. And this framework builds on four main concepts. The first being commitment, the second being expertise, the third being empathy, and the fourth being transparency. I believe this is a very compelling framework because you can begin to assess the leadership responses of any country or any organization based on these main features that build trust and build social cohesion as developed by these researchers drawing on international good practices. So let me begin by focusing on the first ingredient, commitment. Put succinctly, the most powerful and direct way to signal commitment is for leaders to show up in a highly visible manner and take charge. This is the statement of the developer of this framework, Professor Diermeyer of University of Chicago. And I'm going to use this to begin to assess our own leadership response to the crisis here in the Philippines. Now, if you look at the messaging coming from our leadership, there appears to be some mixed messages coming from the Philippine leadership as far as crisis response goes. On Feb 3, 2020, we were told not to be afraid of NCOV by our president. And he mentioned this when we only had 2 cases on the 7-day moving average. Just for those of you who are following this, the 7-day moving average is simply the average number of cases over the 7 days, including that day when it is reported. And it is used as a rough indicator of stability in terms of monitoring the number of cases of COVID-19. Now, following the statement on 3 Feb 2020, not to be afraid of COVID-19, on 31 March 2020, we were further informed not to be afraid because we have enough resources to actually respond to it. Huwag kayong matakot, may pera ako. And this was stated by our president when we had 188 cases under the 7-day moving average on 31 March 2020. Now, a few months later, on 16 June 2020, we were told a completely opposite message, which seems to evoke a lack of control and a lack of effectiveness. In fact, on 16 June 2020, we were told, wala na tayong pera, or we don't have enough resources to respond. And this was during the time when we had 611 cases on the 7-day moving average. Shortly thereafter, on 8 July 2020, the president also said, if you open the entire economy and thousands of new cases happen, then we are in deep trouble, or something to this effect. And he said this when we had 1,599 cases on the 7-day moving average. So it appears, based on these statements from our leadership, that there appears to have been a lack of control evolving in our crisis response. An initial confidence that we could actually address it, and then eventually a lack of confidence in terms of lack of resources and the lack of control in the potential outcomes towards the latter part of the crisis. And this, again, going back to the first ingredient of commitment, appears to suggest very, very mixed messaging as far as the commitment of our leadership and the ability to take control of the crisis and actually handle the crisis in very effective way. This has led to further questions on leadership, and this is also reflected in this call by 14 senators, many of whom are administration allies, for the Secretary of Health to resign, based mainly on a perceived failure to respond well to the crisis, to respond effectively to the crisis. And this was made as early as 16 April 2020. Recently, analysts have also emphasized that there appears to be a lack of leadership that is embedded in our failure in this crisis response. And I will quote directly here from Professor Noel de Jos. The Philippine experience thus far calls into question the quality of the leadership of those put in charge of the national response to this pandemic, and ultimately the prudence of the appointing power. Missing above all is the assurance that any strong scientific input is guiding the direction of policy. So on the first ingredient of commitment, there does seem to be many questions and very mixed messaging relating to this element of commitment and taking control. The second ingredient is expertise, and it also ties into that first ingredient of commitment. Expertise, put very simply, is the evidence-based management of the twin health and economic crises that we are now facing in the Philippines. And here, just to show you the figures, COVID-19 actually put a stop to 84 quarters of uninterrupted economic growth that the Philippines managed to pull together in the past something like almost 40 years. And unfortunately, if you look at, sorry, that's over 20 years. And unfortunately, if you look at the contraction that the Philippines has actually undergone on the second quarter of 2020, which is minus 16.5% growth rate, it is actually much deeper than the deep contractions, economic contractions that we faced during the Marcos years when we faced economic and political instability. So the lockdown, the main measure through which we tried to control the initial spread of the crisis and buy our health system some time to become stronger and to increase its absorptive capacity, has actually come at a very, very high cost, which is the lost economic output and the recession that we are now facing as a country. And unfortunately, if you ask yourself, what have we actually acquired during this time when we are on lockdown and we are trying to buy our systems some time to catch up, it does not seem to be the case that our systems were able to control the spread of COVID-19. In fact, as we were incurring very, very deep economic costs, having implemented one of the longest lockdowns in the world, we are still seeing the spread of COVID-19 in the Philippines. And in fact, around early August, the statistics show that the Philippines actually overtook Indonesia in terms of the number of positive COVID-19 cases. The third ingredient is empathy. So the first ingredient was commitment, the second ingredient was expertise, and the third ingredient is empathy. And I find it useful to draw on this quote as far as describing what empathy is needed as far as the crisis response. We are not all in the same boat. We are all in the same storm. Some are in super yachts. Some have just the one oar. Now, I believe this quote is very, very important to begin to understand the implications of the crisis on different groups because in reality, we are in the same storm, but not everyone is geared to weather this storm well. This actually suggests that many poor and low-income families and individuals in society, in the economy, will definitely need the help coming from the state and from government. So here is one factoid that the national economy is losing 18 billion pesos a day in terms of the lockdown. That's sort of the macro cost of it. But that macro cost shows up at the level of firms. In a DTI survey conducted in June 2020, the DTI reported 26% of businesses closed operations during that month. That, of course, creates displacement, jobs displacement. The Department of Labor and Employment estimates that 10 million workers will lose jobs during this COVID-19 pandemic. And finally, Social Weather Station reported recently that 5.2 million families went hungry or reported experiencing hunger during the COVID-19 crisis. And our country's top think tank, PIDS, recently released a study estimating that about 1.5 million Filipinos will slide back into poverty due to COVID-19. So this gives a sense of the dire situation that poor and low-income Filipinos face during this crisis. This is further reflected in the many images that we see from the field, and this is a poster that we see outside of a community that has been locked down in Cebu recently. In this poster, they note, "If you cannot feed us, free us. The spread of COVID-19 is not our fault. Stop the discrimination." So this is actually the kind of messaging coming from many communities right now, primarily because it seems the government appears to be blaming citizens for the spread of COVID-19. And instead of emphasizing the role of systems and institutions to test, trace, and treat effectively, they are emphasizing instead, the government officials are emphasizing instead the importance of discipline and the importance of compliance with the restrictions that they have now put in place for society, including the mobility restrictions and the lockdowns that are now in place. What's the issue with this? Well, it seems that the blame of the failure of crisis response so far is being placed on citizens and not on the failure of state agents to try and put these adequate systems together. In the words of some of our government officials, ang Pilipino ay pasaway. The Filipino is undisciplined. So the question then is this true, or is this just an allegation? And unfortunately, many of the government officials have actually reflected this kind of messaging to the people. Here's another official who is actually tasked with advancing the testing system for the country. And he said that it's not testing, tracing the healthcare system or the advancement of technology that is important, but it is actually the discipline of the population. So this is very troubling because instead of putting accountability on the government, putting together these adequate test, trace, and treat systems, they are putting the blame on citizens for the continued spread of COVID-19. And in fact, some government officials have seen fit to suggest a shame campaign for those citizens who are ignoring the COVID-19 crisis. Fortunately, we are able to look at emerging data and evidence suggesting that actually Filipinos are disciplined. Many Filipinos actually complied with the mobility restrictions and with the lockdowns based on empirical evidence. And this actually begins to debunk that messaging that the failure of crisis response is primarily due to the lack of discipline of Filipinos. And also, fortunately, some leaders have stepped up to actually speak in defense of their own constituents, basically describing their people, their citizens, as obedient. So this is the mayor of Iloilo City describing Ilonggos as obedient and explaining that many of them may fail to actually comply with some of the restrictions and some of the requirements of lockdown, but not because of lack of discipline, but because of lack of resources or perhaps even poverty. So this again emphasizes the important role of the state to support citizens in order for them to more adequately respond to the policies that we need to put in place in order to contain COVID-19. There are also leaders, promising young leaders such as this one in Pasig City, Mayor Vico Soto, who actually innovated and partnered with the private sector in order to give his constituents, in this case, tricycle drivers, a recovery in income streams, some ability to earn a living despite the crisis, which actually addresses the problems, the deep problems that the crisis and the lockdowns have created. So this is a perfect case where both the lockdown and, of course, the challenges of the citizens were solved by an innovative young leader who tried to find ways to work with stakeholders, to partner with the private sector in order to solve the problems that they're facing. So far I've discussed commitment, I've discussed expertise, and I've discussed empathy. And we have seen that there are some leaders who do not seem to evoke commitment, who their leadership responses that did not evoke enough expertise, but also there are leaders that are showing a lot of empathy and a lot of expertise in their crisis response. So it's sort of a mixed picture in this way. The last ingredient I will discuss with you today is transparency. And here I just want to point out some good news, which is that some aspects of our crisis response has become very, very transparent in a very data-based way. So this is the website set up by the Department of Health that gives a sense of the data and the information related to the COVID-19 health pandemic. And so in fairness and in defense of the Department of Health, there are many technocrats in that agency that have actually, from day one, started to work towards greater transparency in their crisis response. In terms of the Bayanihan law, there is also a frequent reporting of outcomes that is made publicly available that you can download on the government website. That is also a step towards transparency. The challenge, however, is that even with this kind of data transparency, there are many, many weaknesses as far as the information and data collection goes. And even government experts admit that some agencies have lost focus and lost effectiveness because of the delays in collecting data and analyzing data, so that some of the government responses did not appear to be informed immediately by the relevant data. This has prompted some leaders to actually promote certain reforms and certain improvements in the crisis response, such as Vice President Leni Robredo that correctly points out the need for a single repository for the COVID-19 data, a repository that could equip our government actors to actually respond in a very evidence-based way, and also perhaps equip scholars, academia, and other stakeholders to better understand the emerging crisis and how to improve our response as a country. The last important element of transparency, of course, is in terms of accountability and better governance, as well as anti-corruption. And unfortunately, as I am now giving this presentation to you in early August, there's also an ongoing investigation on corruption allegations in PhilHealth, which is the country's main social insurance system. Transparency here will hopefully expose the truth as far as these allegations of corruption are concerned. And if there are indeed cases of corruption, that hopefully it will be stopped immediately. However, the point to make here is that if we had greater transparency to begin with, then perhaps these corruption allegations would not have emerged at all, that corruption would have been exposed immediately, even before and even prior to a pandemic, which we are now facing. So this is really a very bad timing for this kind of corruption cases to emerge. And while we need to stop it, it obviously may lead to a lot more uncertainty and a breakdown of trust. So let me begin to end my presentation with a few thoughts on countries that actually effectively reflected the key leadership ingredients we've been talking about today, which include commitment, expertise, empathy, and transparency. So this is the case of Vietnam, one of the countries that have effectively responded to the crisis. And Vietnam convinced its citizens to voluntarily share personal health information via a government-launched app called NCOV. So Vietnam is one of those examples of strong transparency and trust, and the kind of transparency that reinforces the trust of their citizens. So much of the data and information that the Vietnamese government collects from its citizens, it also makes publicly available so that the citizens in a way can hold their government accountable and can be assured of effective COVID-19 response. The other country is Taiwan, which is world-renowned for its very, very effective and inclusive health insurance system. So here, the quick point to make is that empathy is actually effectively embodied in institutions that promote strong inclusion. So that poor and low-income individuals and communities in a country need not be concerned that they will be left behind, that they will not be, that their challenges will not be addressed during a crisis period. So this reflects strong empathy in the systems that a country like Taiwan has put in place. The third example is Thailand, which has a long track record of strong health campaigns with public-private partnerships. And this evokes the third ingredient, which is commitment, reflected in a strong track record of cooperation. Now, for a country like Thailand, it's very important to actually put in place public-private partnerships because the private sector has a key role to play in crisis response. This is the case also in the Philippines, where the bulk of the health system is actually in the private sector, not in the public sector. So commitment can be reflected in strategies that bring the public sector in, as well as the private sector, in ways that strongly cooperate in crisis response, and that is built on a strong track record of cooperation. And finally, to end the presentation, of course, the lessons from South Korea, which tends to be the gold standard of COVID-19 crisis response. South Korea is well known today to have implemented very effective test, trace, and treat strategies. And these are lessons that it learned the hard way because of its failure to control earlier diseases that spread in that country, including SARS and including MERS. So what the South Koreans have built, including a very effective triage system and strong capability to realign their healthcare system to increase absorptive capacity, is a strong system with the test, trace, and treat objectives put in place for effective crisis response. So South Korea has expertise embedded in very strong institutions. Let me end my presentation with the idea that even as I talked about leadership and the importance of commitment, expertise, empathy, and transparency in building trust and in building social cohesion during a crisis response, let me still emphasize that these countries that successfully responded to the crisis reflected many of these ingredients in actual institutions that deliver strong results. Thank you very much for the chance to share these ideas with you today, and I look forward to our exchange.